So that experience helps me be empathic with fellow therapists' resistance to this, because the news is not always pleasant.
Well, John, I think we both should emphasize, and we're close to the end of the interview, that measuring outcomes for every patient in every setting is absolutely necessary. I mean, let's just state it as the obvious. What other endeavor would you ever do professionally in which you didn't have good information about the quality of your work? And
I'll agree with you 90% on this, Almighty.
okay, good.
I agree that we all need the vital signs of mental health. So we need to know the results. But there is the 10% caveat. I've had some regular patients tell me that keep asking these is actually unempathic. They will tell me.
Yeah.
There are also circumstances, if I'm seeing someone in a crisis, I may forego the outcome monitoring for that session. So I think regular routine outcome monitoring is the way to go. And in 90% of the time, I think it's the empathic research-supported method every single session. But there's always a few exceptions. So I won't quite agree absolutely every session.
Yeah. I would say two things, John, to just take off on that. One is, it's just not the outcome we need to know about. We need to know about the experience of therapy. So in systems that I work with, I also want some indicators of the patient's sense of the treatment. Is this a treatment? Is what we're doing in therapy leading to progress? And the patient's understanding or perception of the therapist. Is this somebody who cares, understands me, and is empathic? So those two dimensions are also really necessary. So not just the outcome, but the process. But
Exactly.
it really
Exactly
comes.
so. And I